My vision, my hearing, my taste. There's literally not one part of me, right down to my fingernails, that has not been affected by this.
Alicia Newnham is one of 400,000 Australians afflicted by long COVID.
I use a wheelchair or a walking frame when I go out, if I have to go out. I've spent close to 11 months bedridden.
Alicia says she was really active until struck down by COVID last year. These days, she's subject to uncontrollable spasms.
Emotionally hard work, and it's just a physical drain. Trying to keep up with things, yeah. Sorry.
What Alicia misses most is her ability to be a mum to her 3 boys, Cade, Ty and Kobe.
I haven't been able to be what I consider to be a proper mum and be there for them and support them. I couldn't even get out of bed most of the time to go and give them a cuddle and say goodnight.
Oh, great work, Kobe.
Once an avid fan at her boys' basketball games, Alicia is now relegated to watching from a distance, at home, in bed, on an iPad.
It's hard laying in bed, watching them, walking out the door, going and going to their things that normally I would be a part of.
COVID is still rampant. There were almost 30,000 cases last week, a rise of 16% nationally. Canberra and Tassie saw the largest changes, with both states seeing a 30% growth in case numbers from the week before. In New South Wales, COVID was up by 25% and Queensland 21%, while Victoria had another 900 cases. 5 to 10% of all cases will become long COVID. As the numbers spiral, Dr Andrew Miller foresees mounting pressure on the economy and the health system.
Worst case scenario, if we continue with unfettered transmissions, that we'll continue to see not only increase in excess mortality and contribution to other diseases that also cause mortality, but we're building an army of sick people.
In Coffs Harbour, Ellie Saavedra Ryan has been battling symptoms a year after contracting COVID.
So I was sick for 2 weeks of holidays, and then I went back to work and I just never got better. I never fully recovered.
Her GP, Dr Kelly Hamill, was quick with a diagnosis.
So it sounds like you're ticking most of the boxes for long COVID. You've got the fatigue, the shortness of breath, the poor exercise tolerance, some insomnia.
Ellie now relies on her husband Oscar to cook and help care for their 11-year-old son, Marcello.
It's changed the level of dependency that I have upon him, and that's been really difficult because I've always been such an independent person.
I try to be heaps more present, more supportive, keep more patient.
There are currently no support systems in place for the sufferers of long COVID, so it needs to be immediate action. It doesn't need to happen 5 or 10 years down the track.
Long COVID can be hard to diagnose, but there are common symptoms like fatigue, heart palpitations, chest and body pain, as well as difficulty breathing. Economist Dr Dominic Marr worries about the cost of all this.
We're currently spending $220 billion a year on healthcare, and an increase of just 1% on that is more than $2 billion a year. So just from that amount of cost alone, there's a lot to be concerned about.
But such arguments are cold comfort to Alicia.
Please hear us. Please help us. Please believe us. Just listen to what COVID can do to vulnerable people. Thousands more people, millions more people will end up like this if something isn't done.
I reckon the hardest thing would be not being believed. Where you go to your doctor or you go see your mates and you say, I've had COVID for a year and it's not getting any better. And people go, oh, yeah, right, sure, we don't believe you. I think that'd be hard.
Yeah, and they've spoken a lot about that medical gaslighting, and as you've seen, that the symptoms can be so vague, being tired and having a hoarse throat and things like that. So just being heard, I think that's a good start, but we need to do a lot more.